You have received surveillance reports from the health facilities in your district and notice an increase in confirmed measles cases. Before you take any action, you need to know: when did people get sick? Where are they located? What populations are affected? And what are some possible causes? Analyzing the surveillance data for the district will help you answer these questions and decide how to respond. Analyzing surveillance data is essential to any immunization program. This is how you identify potential outbreaks and plan strategies to prevent the spread of disease. It is also critical to evaluating the overall effectiveness of your program. In this video, we will review how to analyze surveillance data, look for the underlying causes behind any increases in cases, and decide on a response to address those causes. When you identify an increase in cases, the first step is to analyze the data. Analyzing data is about uncovering patterns, finding out when and where cases are being reported, as well as which populations are being impacted by the disease. First, identify when the cases became ill. Chart cases on an epidemic curve, which shows the frequency of cases over time based on the date of onset of disease. An epidemic curve can track cases by month, by day, or even by hour in an acute situation. This data can help monitor program performance, determine potential causes of an increase in cases or an outbreak, and help plan control strategies. Next, locate where the disease is occurring. Track cases on a spot map, which helps visualize where cases are clustered together by location. This information can help the national level target interventions such as additional immunization services or better communication about immunization in a given area. When the population size varies between the areas you're comparing, a spot map can be misleading. In that case, use an area shade map that shows attack rates in different areas. Then, consider which populations are being affected by the disease. Each month, sort cases by age and gender to identify which populations are most at risk. You might show data in a table like this, or in a graph such as this. You might also analyze cases by other factors such as vaccination status or location. Here, we can see that there are many more cases in children than adults. Knowing the age group will help identify possible causes and plan strategies. Next, look for the underlying causes for an increase in cases. First, determine whether the increase represents an outbreak. Remember, you can identify an outbreak when the number of cases observed is greater than the number normally expected in an area during a given period. These numbers will vary among different diseases and locations. To identify or rule out an outbreak, compare surveillance data with previous years to look for epidemic trends. The increase in cases may be due to an expected trend, such as a seasonal or periodic increase in certain diseases. You can also compare surveillance data with immunization data, such as coverage rates. A rise in cases may be linked to a gap in coverage that accumulated over a few years. This could reveal problems within the system, such as with the cold chain, vaccine supply, or immunization delivery. When looking for causes, also consider changes in your surveillance. Often, a rise in cases can be due to better reporting, such as the implementation of a new surveillance system or its increase in effectiveness. Based on the underlying cause, decide on a response to control and prevent the spread of the disease. There are two general types of responses, often used together: a surveillance response, and an immunization response. A surveillance response involves gathering and sharing additional data to track the cases more closely. This may include going door to door at the community level to actively search for additional unreported cases. Or it may involve investigation and confirmation of suspected cases. An immunization response can vary by disease and country policies, but generally involves an increase or improvement in immunization service delivery to prevent the spread of disease. Some diseases, such as polio, may require urgent, large-scale supplemental immunization as recommended by global policy. For other diseases, the response depends on national or local policy. For example, for neonatal tetanus, the policy may be to immunize the mother with TT as well as all eligible women in surrounding communities. In any immunization response, surveillance data will help target the communities and populations most at risk. Remember, in the case of an outbreak, follow your country's immunization response guidelines, make sure facilities are reporting all cases, expedite the process for reporting vaccine supply issues, and perform an outbreak investigation. You now know how to analyze and take action on surveillance data.